Okay, we'll go ahead and get started. And as more people join, we'll just kind of catch them up as needed. I first like to introduce myself. My name is Mrs. Juliot. I'm one of the, four of us, health career instructors here at Prosser. Betty, Benita, do you want to say hi real quick?
Go ahead, Benita.
You're on mute.
Looks like I'm doing mime work, huh? I think this is my 16th or 17th year here at Prosser. And I always tell my students that I wish I had my class before I went to nursing school because my life would have been a lot easier. But yeah, it's a great program. So when Sandy's done, if you have any questions, shoot them our way. Betty?
My name is Betty McGee, Miss McGee, and I teach sterile processing. And I've been here about 4 years. And it was a relatively new program when I came here. So there's a lot of questions about what sterile processing is about. So if you have any questions, please let me know or ask me after the beginning of our presentation.
And Miss Reed?
Hello, my name is Penny Reed, and I'm one of the health careers instructors. I have been here at Prosser for 18 years, I think it's been. For the CNA portion is my specialty. So I won't be on here long, but if you have any questions, you can ask them or you can email me at preed at nafcs.org.
Mm-hmm. Yes, we all can be found on the New Albany-Floyd County website. In particular, if you go, once you click on the website, you can go to Prosser, and it has a list of all the health career instructors, so you can email us questions, and they can make sure it gets navigated to us as well. So we have more join now, so we'll go ahead and get started since we're only here till 6:30. Like I said, welcome to Prosser Health Careers. Our department, we have 4 instructors, and we have 1 paraprofessional, Mrs. Lewis, who's not with us tonight. She helps coordinate a lot of things that we do, mainly pertaining to our senior year with our students. But Prosser Health Careers, we have the AM session, which is primarily juniors. And during that session, we offer medical terminology and healthcare science. And those classes are each 3 college credits. Our dual credits is through Ivy Tech, so that's where the student earns their college credit. And that credit can be transferred to any Indiana State College. So that's always a question many parents have. If they take these credits, can they go to another college? And many Indiana State colleges accept those credits along with Ivy Tech. And what we have found too is some in the Southern Indiana, Louisville area, colleges such as like U of L, even UK have accepted these credits as well because those are state colleges. So that is basically our junior year. In addition to medical terminology and healthcare science, they will also become CPR certified. That is a prerequisite and a requirement for their senior year here at Prosser. The morning session runs from 7:55 till 10:35 in the morning. And during that time, we go over both of those classes. We have medical terminology and healthcare science that we do while they're here at Prosser. And of course, right now this year, we are actually in person right now teaching. Hopefully, fingers crossed, we can maintain that for the rest of the school year. But we've also had temporary virtual, which was just right before the holidays, Thanksgiving and Christmas holiday. We were temporarily virtual due to COVID, but hopefully we can stay in-person teaching for the rest of the year. Some more information just about Prosser in general. Our grading scale is very similar to most students at their home schools, but we have what's called a running term. So that means first quarter runs into second quarter, and then that gives them a first semester grade. Then third quarter runs into fourth quarter, and that gives them second semester grade. So we call that a running term. Also, another thing that's very important while attending Prosser is attendance. And like I said, right now we're in person. It is very important and very critical that they attend classes, whether it's in person or virtual, especially at this time. Let's see. Going into our senior year, we offer a couple of variety of pathways, and I really don't want to talk too in depth in them because they are very, very detailed. We talk with our juniors about this pathway, usually right around the end of third quarter or fourth quarter when they're making their schedules out for senior year. And we go over this sheet. I'm trying to show you a little bit closer. I didn't have electronic copy with me, but it goes over a couple of different pathways that they will have an option to choose from at the end of their junior year, which is the AM session. One in particular is the CNA certification program, and that's what Miss Reed and Miss Cadle teach along with myself. The second option is the pre-nursing, and along with CNA, I also teach the pre-nursing course, and these are Ivy Tech classes that they receive the pre-nursing certification and can then apply to the nursing program at Ivy Tech at the end of their senior year. But just like anyone else at Ivy Tech, they're in heavy competition for those 40 seats. So they don't take them specifically all from Prosser. It's all the students as well from Ivy Tech. And then the third option is sterile processing central service technician, and that is Mrs. McGee. That is her specialty for senior year. Now with the sterile processing central service technician program, though, they do not earn their CNA. This is a completely different track that I'll let her kind of elaborate on. But with the pre-nursing and the CNA certification, we do go out in clinicals, and we have all year, and we still are out in clinicals, even during the pandemic, even during the COVID. That is part of healthcare, and many of our students have ended up getting jobs at the facilities that they actually had performed their clinicals at. And usually by the end of the year, almost probably at least 75–80% of all our students have jobs at a healthcare facility. And yes, we worked right through the pandemic, and we still are. We wear face masks, we wear face shields, we're COVID tested weekly, sometimes bi-weekly, depending on the outbreak in the facility. And we work right through it. So that's one of the things with health careers. If you don't think you're able to work in a healthcare facility, especially during times like now, then probably health careers isn't a good choice for you. All our students were great troopers, loved every minute of it. And like I said, most have jobs and are currently working in those facilities. And we are now testing for CNA certification. So that is a state exam that the facilitator comes here to Prosser. They take a written exam, and then they also take a skills portion for the state exam. And we have had very high success rate with that. I think we're at 100% for several years now consecutively. Also, I talked about the dual credits with Ivy Tech. We have the CNA certification. We also have the CPR certification that they get. And we also do what's called a job shadow. In their junior year, which is the morning class, they will be given an assignment to do a job shadow. And the job shadow ranges from 4 to 6 hours in a medical field that they're interested in a healthcare facility. And it's strictly what we said, a shadow. You are to shadow that person in the career field that you are interested in. And that's given, like I said, in the AM session, commonly their junior year. So Penny or Benita, did y'all have anything else to add to those?
Not really. Our seniors wear Navy scrubs. Attendance is important, and it's very important that they have their own reliable transportation. So, and we've had some juniors who couldn't come back their senior year because, you know, not everyone can afford a car. And, you know, there's the gas involved in that. So that's another big sacrifice is providing your own transportation as a senior.
Ms. Reed, did you have any comments or?
No, I think you guys summed it up pretty good.
Okay. Okay, great. Ms. McGee, did you want to give them kind of a brief description of your senior program? Now, in the mornings, Ms. McGee is teaching the same classes that me, Ms. Cato, and Ms. Reed teach. It's the medical terminology and healthcare science. It's senior year where we all kind of branch off to our own programs. So Ms. McGee has the Central Service Technician Sterile Processing program. And I'll let her give you all a brief description on that.
So the SPD, our sterile processing program, Central Service Program, it's also called, is we start our clinicals about the same time that the CNAs do. It's around October, or at least that's what we're projecting for next year. And you'll go to the hospital and you will actually take the instruments that come from the operating room down to the central sterile area, and you will process those and return them back to surgery. That's everything in a nutshell that you do. You work in different areas of that department, but the credits that we get from IV Tech are health and wellness, your senior year, and law and ethics. I've talked to a few students today, and I asked them what questions would they have asked now that they've gone through the program, and that was one of the things that they said. Make sure they know that they're going to be taking law and ethics and health and wellness, and that they're not just going to wash the instruments, that they're actually going to put them in an autoclave, process them, and send them back to surgery. So, and that they take an international certification at the end of the class. The class requires, in order to take the certification, you have to have 400 hours. But we accumulate anywhere from 250 to 300 hours, clinical hours, if you start in October and you attend every day. And you put in 3 hours Tuesday, Wednesday, and Thursday. And then once you accumulate your 300 hours, you can get a job and finish your other 100 hours, and then you're ready to take the national certification. So you have to acquire 400 clinical hours before you can do that. The average income per hour is $18 to $20 an hour. There are a few facilities that still start out at 15, but not many. This past year, the salaries went up. This is a program that if you're going to take it, realize that you're not going to be involved with the patients one-on-one. The only way you're going to be involved with the patients is the surgical instruments that we actually prepare, go back to surgery, and the instruments are used on the patient. There are a few ways to get involved with the patients, but it takes a little bit more education and experience, and it would require a different position. And it also is later on down the line after you certify in a couple of different areas in SPD. So there is a way to advance in SPD. You also serve some time in materials management during your clinical area when you're at the hospitals. And during that time, you learn a little bit about distribution of materials in the hospital and how that works. If for some reason you decided, I don't really like the SPD aspect of sterile processing, but I do like the materials management aspect of this program, you can always try and get a job in materials management. There are plenty of jobs out there in that area of sterile processing also. So you have some different options And then after you get some experience and you get certified, you have more options to advance. The other thing I would tell you is, which is pretty important to know, a lot of our clinical sites are across the river in Kentucky, in Louisville. Our partnerships are with the University of Louisville, which just merged with Jewish this year, Jewish Hospital. So we actually go to the University of Louisville, downtown Jewish Hospital, Jewish Hospital East, which is out off of Breckenridge Lane in Louisville, Kentucky. We go to Jewish Shelbyville, which is actually in Shelbyville. We also go to St. Mary's, which is also affiliated with Jewish Hospital. And then we go to Baptist East, which is out in the east end of Louisville. And then some of the outlining hospitals and Indiana hospitals are PMC Regional, which is just a couple of streets up from Prosser. And then Harrison County, which is in Harrison County. And then Schneck Medical, which we partnershiped last year with, and that is in Seymour. So those people that live up towards the Scottsburg area or in that direction, that is an option for them as far as their clinical site. And then we are in the process, probably by the end of the week, we'll be affiliated with the hospital in Jasper, Indiana, and that's Memorial Hospital. So for those people who are up in Crawford, the Crawford area, that hospital will be relatively close to you to do your clinicals, which is important to us because we want to be able to provide the whole county on the Kentucky side and the Indiana side SPD techs because there's a shortage. There, if you go on the website of any hospital and you go to careers, you'll see that there are positions open for SPD techs a little bit of everywhere.
Okay. So now we're going to open it up to our audience that is logged in here to our virtual live stream. What questions do you have for us? Either myself, Ms. McGee, Ms. Cadle, or Ms. Reed. We'll try and answer them as you all ask us any questions. If your microphones don't work, you can also put over in the group chat, which I will watch that as well. So if any questions, you want to type them in. If you don't want to talk on the microphone, that's fine. You can type them in as well. So feel free to ask away. Yes.
So y'all talked about like the multiple different healthcare facilities or hospitals where you could do those hours. Would it be sort of like I could find one of those that's closer to me, or is it assigned at random?
What we like to do with all of our clinicals, even CNA or the central service technician that Ms. McGee was just talking about, we try to get them as close as possible to your home school or where you live. So the only exception is with the CNA clinical hours that you have to accrue has to be with one of us instructors, me, Ms. Cadle, or Ms. Reed. And we go to, right now we currently have, I have Autumn Woods here in New Albany. Ms. Cadle has Azalea Hills and Floyd Knobs, and Ms. Reed has Clark Rehab in Clarksville, right? And then after you get those hours, then if you ought to do a second clinical rotation, we try and get you into a facility that's closest to you and your home school. So, and we have them all the way from Schneck Memorial up about in Seymour, all the way to U of L Hospital across the river. So we have a wide variety of areas and facilities that we use for the second clinical rotation.
Our paraprofessional, Ms. Lewis, looks at the demographics of all of the students because there may be other students that live out your way. So that we just have to look at it as a whole and see where everybody is from and do our best to get you as close as we can.
Okay.
It's kind of like a potluck every year.
Does that
There-
answer, does that answer your question, Caroline?
Yeah. I was just like, some of those places are pretty far away from me
Yeah.
to get to.
Most of those sites are the SPD sites that are pretty far away.
We do try to put you as close as we can. Occasionally, there's a facility that will take 1 or 2 students that they will do the checkoffs, but we can't make them take you. It is their choice. So it's what they can handle. So it might get you a little bit closer so you don't have to drive as much. And then we have a question in the chat, Sandy.
Yes, it says, how many students are selected for each program their senior year? So sterile processing, Ms. McGee, how many do you normally take, an average?
Since I've been here, the average has been about 15.
Okay. For this pre-nursing program, I take around 20, 22 students, depending on what the principal will allow. And then for the CNA program, there's no limit on that. For Miss Reed and Miss Cadle, about how many right now do you have in your classes, about average?
I've got 21.
I have 18.
Yeah. So there's, a lot of students who choose not to do the pre-nursing or the central service technician, and then they just stay into the CNA program. Now, with the pre-nursing program, though, it is very highly competitive. The principal and the counselors do look at like GPAs, attendance, behaviors, not just at Prosser, but at your home school. And it is a highly competitive class to be in for the senior year. This past year, I had over 45 students apply for it, and currently I have 22 students. So it was very, very tight to get into that program. And I would imagine from here on out, it's going to continue. We've done this program now going on 4 years for the pre-nursing certification. And every year it is a very tight selection to get into that program. The next question, how many college credits can you earn? So your junior year, you will earn 3 credits for medical terminology, 3 credits for healthcare science, and a half a credit for CPR. So junior year, it's 6.5. Senior year, you definitely, if you do CNA, it's 5 credits. We also teach health and wellness, which is 3 credits. Dementia certification, which is 3 more credits. So 11 credits at a minimum, and then depending on which way you take.
Hey, Sandy.
Betty doesn't teach the CNA, so her numbers are a little bit different.
Yeah, and Sandy, we do need to let them know that they have to qualify for some of those college credits. It's not automatic.
Right.
Especially medical terminology. You have to have a cumulative GPA, and I believe it's 2.5.
That sounds about right.
Yeah, that Ivy Tech has set.
Or a certain PSAT score.
Uh-huh.
And if you don't have those, if you score so high on the Ivy Tech placement exam, you can get it.
Yes, and our counselor, Miss Prince, is really good about working with those students. 2.6 GPA or pass the knowledge assessment test. So that was our counselor that chimed in to answer that. Does Prosser's schedule follow the high school schedule? Ms. Cadle answered, we follow New Albany Floyd County school system schedule. So whatever they have as far as when we start, when we stop, and all the vacations, it's New Albany Floyd County, and snow days and everything in between. What are the differences between pre-nursing and CNA classes? Actually, they get to take both. So first semester, we would do CNA certification. And then in addition to that, with the pre-nursing, you earn your psychology, you take psychology, English composition, anatomy and physiology with the lab. So they earn a few more extra classes for the pre-nursing. And
But it's important to remember too that these are college level courses, so they're not easy. Even our medical terminology requires homework every night and studying for frequent quizzes. So don't think that you're coming to Prosser just to get away from your homeschool and have less work, because you'll be disappointed.
yes. And
Carolyn Witten has a question.
Yeah, so y'all talked about qualifying for the different paths and all that, and looking at school records and things. I'm homeschooled, so how would that work for me? Do you know?
I've had a homeschool student almost every year, so your parent would just need to apply.
Okay.
mhm.
When you say you look at like your record at your home school for like behavior and grades, specifically for behavior, how would that work for me as well?
Well, I guess you would probably just talk to your mom or dad, but you should be able to get a transcript from your online schooling.
Oh, okay.
And Carolyn, if you misbehave, we're calling your mom.
That is motivation enough.
That's your principal, and that's who we calling.
Yeah. And then, of course, also because you do attend Prosser your junior year, so we look at, behavior, attendance, and your grades here at Prosser. So it would be more based on Prosser than anything for you in that case.
Okay.
Somebody else raised their hand. Tanisha?
Yes, I have a question. I will be a junior next year.
Mhm.
And so just like normal school, will we have to be signed in like enrolled like a normal school?
Yes. Your counselors will be working with you probably here in a couple of weeks. They usually try and do it, I think, before spring break. So probably here around February, middle of February, your high school counselors will be working with you and getting a schedule set for next year. So picking and choosing classes. So at that time, that's when, if you want to attend Prosser, you will tell them, and you will tell them you want to do health careers. Because in the morning, junior year, everyone takes the same classes. It's not till your senior year that you kind of choose a different pathway. Does that answer your question?
Yeah, I heard one of the teachers on here saying that not everybody has a car. What do you guys mean by that?
As a what?
That's pertaining to your senior year when you do clinicals. Your senior year, you will have to have transportation. And when we say transportation, reliable transportation, because you will be responsible to get yourself to clinicals, to and from clinicals 3 days a week. So it has to be very reliable transportation.
Okay, thank you.
Okay. And then the counselor even chimed in. She said, Tanisha, you need to tell your counselor now that you want to come to Prosser. Don't wait. So make it, or if you can, if you're, I don't know if you're in person or if you're virtual, but go ahead and send them an email saying, sign me up for Prosser. So that kind of gives them a head start, and they know automatically you want to come to Prosser, and all you got to do is tell them health careers. There was a question. Once they select their path for senior year, when would they find out which path they get selected for? So, like I said, we usually do that around spring break or early spring, and you'll find out before you leave your junior year. Yeah, Miss Cato said. Hopefully we'll still be in person, knock on wood, fingers crossed, that I know whatever you got to do, we can remain in person for the rest of the year. And we do all this right around spring break when they come back. So early spring, they will know which pathway they go into for senior year. Somebody else?
One of my questions, I was looking through all the courses y'all had, and I saw there was an introductory pharmacy course that you could take in your senior year. Would it be plausible that you could take the junior year of this and go into the senior pharmacy thing?
The pharmacy class is taught after school by Ivy Tech. So it would be possible that you could do PM Prosser and then stay and do pre-pharmacy after school. Once again, you'd have to have your own transportation because you'd have to be able to get home, like at 5:30, 6 o'clock when the class finishes.
Okay. I didn't know that they could be done simultaneously.
Mm-hmm.
Don't they have to be 18 as well to do the pharmacology?
Yes, yes.
I'm going to interrupt just for a second on the pre-pharmacy. Carolyn, most schools will not let you take 2 courses at Prosser.
Oh, okay.
So if you could do health careers your first year and then possibly do pre-pharmacy as a senior, but most schools will not let you take 2 Prosser classes at the same time.
Okay.
But you're homeschool, right, Carolyn?
Yes.
Caroline? Okay.
Yes, ma'am.
So,
It would still depend on the school system though that she's a part of. So,
Okay.
yeah.
Okay, so that would be a good question to start asking now then, if you can double up or not. So tell your mom or parent or guardian and ask those questions. So then when we start taking the applications and everything for Prosser, you're ready.
Okay.
Anyone else raise their hand? Okay.
Allison?
Anybody have a question?
Tanisha has her hand up.
Okay.
You guys have a career center, one of them in Clarksville, Indiana, right? Around there, maybe?
We have a clinical site that's in Clarksville, but not the Prosser Career Education Center is in New Albany.
Okay.
I saw that raised hand. I thought it was Allison Young. I'm sorry.
That's okay. Anyone else? Well, it's 6:30, and like we said, if you go to New Albany Floyd County website and you click on Prosser, then you can click on faculty. Our emails are there, so if you come up with any more questions, please feel free to email us. Prosser will make sure it gets to the right instructors for health careers, so us that you got to talk to tonight. And we look forward to seeing everyone next year in person. Fingers crossed.
Right.
Fingers crossed. Okay.
Thank you for attending.
Yes.
Thank
Thank you.
Thank you for attending.
Hope you have a
Thank
good
you so
night.
much for answering all our questions.